So first of all, as we know, the COVID-19 cluster in Thonglo and entertainment venues is the UK strain of the coronavirus. So the first question is, how did the UK strain of the virus manage to enter Thailand?
Well, about 4 months ago, we had a family, 4 members of a family from the UK get into the country, and then they underwent state quarantine, strictly underwent this for 14 days in the state quarantine. And they were proved to have the UK strain of the COVID-19. However, because they were strictly under quarantine in the state quarantine, no episode of there's no any clue that the UK strain can get into the Thai community. But this time, no one knows exactly what is the mechanism why we have this UK strain at the Thonglo Entertainment Complex. But in Thailand, sometimes people who get into the state quarantine, although they have been controlled by all the mechanism that we provide, there's someone who escaped from the mechanism or all this regulation. I cannot say exactly at the moment how this UK strain get into the Thonglo complex, but the only thing we know that we already have this in Thailand.
Right, so how severe is the UK strain in terms of the symptoms compared to the previous strains that we are familiar with in Thailand?
Yeah, in fact, we know this UK strain, it began in about March and April of last year, when the first case of UK strain could be identified in the UK. At that time, because the rapid spreading of the COVID-19 in the UK made the scientists to look at the genetic sequence of the COVID-19, which shows some kind of mutation compared to the Wuhan original strain. We know in September of last year that this strain can spread more rapidly, almost 10 times more rapid than the original Wuhan strain. But actually look at the severity of the people who got this the UK strain. There's no significant severity, increase in severity compared to the Wuhan strain. So we know exactly right now, this strain can spread more rapidly than the original Wuhan strain. But look at the severity of the cases, there's no difference. There are no difference in symptoms for those who get the Wuhan strain, original strain, or this UK strain.
So is there a possibility that there are more mutations later on?
Obviously. In fact, we know that there are at least 3 significant mutations of the COVID-19. One is the South African strain, which, if you look at the news, the Pfizer, Moderna, and also the AstraZeneca vaccine might have a significant less efficacy to cover this South African strain compared to the UK strain. For the UK strain, I mean, the vaccine can cover them quite well, like the original strain. But for the South African strain, and also there's another strain that seem to have the higher severity than the Brazilian strain. If you look at the figure right now, Brazil is now in the trouble. There's a catastrophic spread of the virus in the Brazil, and also the increase in mortality in the Brazilian population. There's another strain, there's another mutation in Philippines, but more or less there's no significant increase in severity of that strain.
Now back to Thailand, now that we're seeing the UK strain, how do you foresee the rate of infections in the next couple of weeks?
Right now, it's not a good time to have this UK strain because we're going to have the Songkran festival next week. And because of this festival, you can expect people to travel from province to another provinces. And you can see a lot of people will enjoy going to the entertainment complex and what happened this week. And so there's a higher chance to have a widespread of COVID-19. 2 weeks after the Songkran festival, I expect to see an increase in number of the new cases per day 2 weeks after this. Hopefully we can stop people from enjoy themselves in the Songkran festival. I sent out lots of message during these 2 days, convincing people to stay home, convince people to wear masks, to keep physical distancing, because right now we have already vaccinated Thai people, less than 1% of the population. So nothing you can expect from the vaccination of the COVID-19. The only thing that we can cope with is to prevent the spread of the COVID-19 is to use the social intervention, the physical distancing, hand cleansing, and use of face masks, whatever.
So when is it considered appropriate to impose further restrictions in your perspective?
I do believe it's necessary to do it. I do believe it's necessary to do it because the rapid spreading of this UK strain, no one knows exactly at the moment how high the percentage of the UK strain among the Thai people who got infected by the COVID-19. Just only about 20 people in the Thonglo, in the Thonglo area that can identify up to 70% of these 20 people have the UK strain. But it doesn't mean that the UK strain already detect up to 70% of the total COVID-19 cases in Thailand. So whatever is already there, and you can expect to have some people who already carry this UK strain. So the only thing to do is to keep the regulation to prevent people to go to the area that carry the high risk of spreading of the virus.
There have been concerns that people traveling back home during Songkran will contribute to the further spread of COVID-19. But on the other side of it, the government actually said that it's okay to travel because they don't want to close the economy during this time. What would be your opinion on this issue?
May I provide you some information? At least last month, at least 2 families whose the daughter of those 2 families, they were infected with COVID-19. They didn't realize that they got infected by the COVID-19, and then they went to visit their parents in some rural area. What happened after that? Both their parents died because of COVID-19. What I'm going to say is that it is not safe at the moment because we have not tested everyone COVID-19. That the majority of people, particularly at the Siriraj hospital, who came to request for the test, they had no symptom at all. They just contact someone who came from who had a chance to contact with people at the Thonglo area, and then the test turned out to be positive. So there's a lot of people who will go to visit their parents in the rural area, and if they had the virus, it's a higher chance for their parents to get. And you know that for elderly people, if they get infected by the virus, there are high mortality rates. So I would suggest the government I don't think the government will set up a regulation to prevent people to travel from province to province, but I think our own consciousness. I mean, you can visit your parents at any time, but should not be at this moment because there is a risky period to spread the virus.
And now that the entertainment venues in 41 provinces that have been closed for around 2 weeks to contain the spread of COVID-19, and that includes Bangkok and other restrictions, do you think the government is on the right track, or is there something else that they can do more?
I think the government is in the right track, but I don't think it's enough. For example, they stop the pub. People cannot go to have some, for example, spill in the pub, but I do believe they will buy some of this spirit and ask friends to join there in the home, and that's the situation more or less like to have some spirit in the pub because people gathering together. I don't believe anyone who have that entertain. They have to have people in their home and then they use the mask. I don't think they will do that. So there's still a higher chance to spread the virus So close up all the pub is good, but at the same time, I don't think it's good enough. You have to provide information, warn people not to join some of these things to have this in their family in order to prevent the spread of the virus.
Right, so back to the issue on the UK strain of the coronavirus, it is confirmed that the virus infected in many cases this time around is the UK strain. So what are the main different factors of this strain compared to the one we experienced last year in Thailand?
This we call the B117 strain. It spread more rapidly. And we do not do the test in order to identify whether the COVID-19 infected people, they have this strain or not. It's quite expensive. And it's not useful to try to identify it because more or less you treat it the same. Whether the Wuhan strain or the UK strain, you treat it the same. The only thing that you know that because of this UK strain, you have to raise up all the regulation to ask people to keep physical distancing to avoid themselves to get the virus and to spread the virus. That's the only thing that you can do.
And there was an expert opinion that said that the world is not fast enough in getting people vaccinated and it will give viruses more chances to mutate. Do you think is this true?
It's true. Definitely it's true. In fact, the World Health Organization declared a couple of weeks ago that we right here, not the Thai people, but also the whole world, we are not fast enough. At least 25% of the population in any country to be vaccinated in order to have the positive effect of the vaccination in this country. In Thailand, we right now we have less than 1% of the population who are vaccinated. In many countries, for example, in Brazil, they're just less than 10% of population. But for countries with have more than 20%, 25%, for example, Israel and the UK, they have up to 40% or even 50% in those countries that you can have the positive effect of vaccination. So I have to say that we are now back to the situation where the new cases of the COVID-19 went up to up to 1 million every 2 days, just like the time when the world do not have the vaccine at all, because the virus, they mutate themselves faster than the speed that we have the vaccination.
Would you say the current situation we're facing right now in Thailand is much worse than what we've seen last year?
Look at the number of the deaths, of the total death is better than compared to the last year. It is not because of the virus, but because we will prepare. We know how to tackle with the infection. We know how to tackle with the critical cases. But you can see we have a marked increase in number of new cases per day. So, and as long as we still have this UK strain, you can expect to have more rapid spreading of the infection.
Right. And one last question, what would be your advice to people right now, especially during Songkran celebrations, and how to protect yourselves during this time?
If it is not necessary, I would like to suggest to stay in where you are, avoid traveling across the province in order to not to spread the disease, use all the physical mechanism, use all the social mechanism that we have done a good job. Last year, I used the face mask, physical distancing, and hand cleansing. At the same time, if you have been scheduled to have the vaccine, please do not hesitate to have the vaccine because it's safe, and the more rapid we have the vaccine, we can prevent Thailand for the catastrophic of this COVID-19.
Definitely. All right. Thank you so much for today.
Thank you.
สวัสดีค่ะ
Hope you will be safe from the COVID-19.
You too สวัสดีค่ะ